felt that this is the time to break the silence and to start having conversations about mental health. What motivated our team to develop this project was the disproportionate impact of COVID-19 on the South Asian community in the Peel region. This pandemic not only magnified the health inequities, it also highlighted a silent mental health crisis that was going on in our community.
It's one of those things that the stigma has always been there, the need has always been there, but during COVID especially, those needs were amplified like so much, and there's so many factors to do with it, right? There was lack of resources. We're very social people, so I think that losing that access to our social circles, to our families, especially for newcomers and international students, and those are just two examples, right? There's so many other things that affected our communities.
One of the main factor is lack of culturally responsive mental health services and resources.
Our Boost Wellness program is for a series of workshops for age 16 to 28. Especially been helpful for international students and newcomers especially, but of course we're open to all. We go over topics that we feel impacted the youth the most, and we offer a lot of space for discussion. We provide a lot of resources. We're there as additional support in terms of providing referrals within the community and supporting them through accessing those services. Another step of the program is where we do involve the family. So we have a program for parents and caregivers called Circle of Care. So those are also workshops where we gear the topics more towards what are the parents' needs, right? Things around communication and supporting others, supporting your loved ones and people in your life, as well as supporting your own emotions. We open them up to the idea of therapy, and we found that that has been one of the most beautiful things that came out of these programs. We've heard from both our youth program and our caregiver program that a lot of them felt more open to reaching out, looking for those culturally responsive services. They felt a lot of support even within the space of our workshops, right? Showing that it's a safe space for the youth to talk openly and honestly, even the parents as well. The third leg of our programming is Chai and Chat sessions. So these are bi-weekly sessions, and really brings that social support in as well. It's such a great way for people of all ages in our community to interact. The younger folk will ask questions to the older folk. The older folk can reassure them that it'll be okay. They've been really fun ways to interact and create friendships where we thought we couldn't find them, right?
All of our facilitators were fluent in Hindi, Punjabi, and Urdu, so we kind of try to, match that gap where people are not comfortable in English. Maybe they want to talk about their feelings in Hindi. Maybe they're more comfortable in sharing about their mental health in Punjabi. So we kind of feel that being comfortable in a language that you speak, it's easier to communicate your feelings, your emotions. Maybe just even mentioning the words for mental health used in Hindi, Punjabi, and Urdu takes a long way. When I moved to Canada, I had my own personal immigration journey. I came here as an international student, and it's not been a long time here in Canada, but I could see when I moved, I was missing my cultural piece, I was missing my family. There were a lot of things I was struggling with, but I didn't know where to go or whom to even share my mental health difficulties, or just if I'm feeling low, where should I go and talk to? I hope that with a project like Boost Wellness, no newcomer or an international student feels that gap. They feel that, there is someone who understands them in their language, and just make people more comfortable in South Asian community that mental health exists and it's real for all.
We've seen a huge reduction in stigma, especially in our Circle of Care programming. So it gives me a lot of hope that things will change.